Choose country. Discover the rural practice pathway to a health career in WA.
I'm a doctor at Bunbury Hospital. I've been working here for 3 years. I'm married. I have a little 2-year-old girl and another little one on the way in a couple of months. So I did RCS down in Busselton. For my intern year, we were the first year that did 4 of the 5 rotations down here in Bunbury. So the 4 that I did were Gen Med, Gen Surg, Ortho, and then an ED term. Hey guys, how we going? That's good. How's the patient? Bunbury's a nice mix. It's not too big, not too small. It's small enough that you get to work closely along with your colleagues. You get to know almost everyone in the hospital really. But it's also big enough where you do have access to all the different specialties. You have access to similar technologies to what you're going to find in all the tertiary centres. In a bigger hospital, in a bigger setting, you get lost amongst all the numbers of juniors and everyone else that's running around. It's also big enough in that you're not necessarily going to bump into someone that you treated the day before. You're not going to feel like you're in a fishbowl, when you're walking down the street. So it's a nice mix between the two. As a junior, or at any level, you're encouraged to jump straight in. So from day one, even when you're in ED as an intern, you're encouraged, whoever it is walks through the door, feel free to go see him rather than potentially being stuck in fast track or just dealing with simple things. And again, overnight, you're one of 3 staff. So if your multi-trauma comes through the door, then you're very much part of the team. We're very much dealing with it, getting your hands dirty and getting involved in the treatment, which maybe you wouldn't be exposed to that in a bigger centre, whereas that would be left to the more senior doctors. Another big advantage of the ED here is that it sees paediatric patients. It's just brilliant exposure to prepare you for whatever you're going to do down the track, really, like wherever you are working, whatever you may specialise in. I chose the rural placement career path, I suppose because I knew this is where I wanted to live and work in the future. Obviously it's a busy job and there's plenty of hours, but I think the good bit here is as soon as you get home, you're here, you're in a beautiful part of the world, and whatever you want to do, you can do it straight away. I have a connection with the area, I have family down here. The lifestyle reasons that lured me down this way are the same reasons that lure most of my colleagues. It's nice to have that bit more relaxed relationship, particularly with your bosses. I suppose if they're coming in relaxed, then your life's that much easier. There's enough support and backup and enough understanding, I think, because everyone is into the lifestyle down here, that you can very easily strike a nice mix between work and play.
Choose country. Discover the rural practice pathway to a health career in WA.